Hi, it's David Green, founder and CEO of Arthritis Stem Cell International. We have a clinic now just over the border from San Diego in Mexico, 20 minutes from the San Diego International Airport. It's a very convenient location, and one of the most common conditions that we offer treatment for is knee arthritis. Now, knee arthritis comes in many sizes, shapes, and colors, if you will. Everything from mild to moderate to really severe. And we see it all with our expert stem cell doctors in Tijuana, Mexico. We do offer VIP Escort transportation from San Diego to the clinic and back. And all of our patients get the medical tourism certificates so that they get through the border very quickly. You won't have to wait hours like most folks do, coming back. Don't have to worry about that, okay? Does stem cell therapy work for knee arthritis? The answer is absolutely. When you think about undergoing a total knee replacement, and there's hundreds of thousands of those done in the US every year and Canada, 1 out of 3 have been shown to be completely unhappy with their total knee replacement after a year. And that statistic continues to rise over 3, 4, 5 years to where it's close to 45%. We used to think it was a very high satisfaction procedure. And when you look at the risks of total knee replacement, they cannot be ignored. If you don't get back your range of motion after a few months, you'll never get it back. A lot of people continue to have pain afterwards. With the stem cell therapy, none of those risks are involved. It's a non-operative procedure. There's no incisions or any of that, no downtime. And what we offer is 30 million live stem cells for only an investment of $2,950. That's it. The stem cells are very active, powerful, and potent. They're between the 2nd and the 8th generation. They're not 15th, 20th, 30th generation like most international clinics because they culture and culture and culture and they get lazy, okay? At our clinic, they're very active, powerful, and potent. The lab where we get our stem cells has safety standards that exceed those of the FDA here in the United States. We've never had a significant adverse event. It's been a very, very safe procedure, very effective. Close to 90%, about 88-90% of patients after a year say they would have the procedure again. So very effective outcomes. And that's not just for mild to moderate arthritis of the knee, but severe as well. People think with bone-on-bone arthritis, there's no cartilage to work with, and that's actually a falsehood. That's a myth. Because even if you were to do a knee replacement on someone who has what you think is end-stage arthritis, you do still see some strips of white, which is cartilage. So you are still making cartilage. And with the stem cell therapy, all you need is an additional 1, 2, or 3 millimeters to get exceptional pain relief. You don't need to take it back to what God gave you to get really good relief for a long period of time. So give us a call today at 888-988-0515 and we'll set you up for that free phone consultation. Thank you. We look forward to hearing from you.